Thank you for choosing Tanner Medical Center for your orthopedic needs. This is Joint Academy, a total joint replacement education resource provided to our patients that are scheduled for total hip replacement and total knee replacement. Together, Tanner works with your orthopedic office to take care of all of your muscle, bone, and joint needs. This includes spine surgery, joint replacement, sports medicine, and rehabilitation. Your Tanner resource for these services is the Orthopedic and Spine Coordinator. That person can be reached at 770-812-5547. Welcome to the Joint Academy class. We want to provide you with valuable information on what to expect before, during, and after your surgery. This gives you an opportunity to prepare for surgery and to prepare questions that are specific for you. This helps lower your anxiety level by being informed and supported. After the class, there is a quiz that is online at tanner.org. It can be found under Services, Orthopedic Care, Resources, or you can scan the code in your paper copy of the presentation that is found in your Joint Academy binder. If you would prefer a written quiz, please ask your Tanner nurse, the preoperative nurse, or the orthopedic and spine coordinator. Complete any health questionnaires that have been assigned to you through MyChart if you have not already. All patients that are scheduled for a total hip replacement or a total knee replacement are required to complete preoperative questionnaires before their surgery. These questionnaires, if you have MyChart, are sent to you through MyChart once your surgery is scheduled. After your surgery is done, you will have the same questionnaires sent to you 300 days after your surgery. If you do not have MyChart, these questionnaires can be completed with your nurse or through mail or phone. This illustration is what a knee looks like before and after surgery. In the before picture, you can see that the bone has some degenerated bone. This may cause your knee to pop, grind, crack, swell, pain. The picture on the right is after total knee replacement surgery, where the physician removes that degenerated bone and places the prosthesis. This is an illustration of total hip replacement. In the before picture, you can see that the ball and socket joint has degenerated bone, likely arthritis, painful hip. The illustration on the right shows the degenerated bone removed and the prosthesis in place. Your surgeon may have scheduled you for a robotic-assisted joint replacement. If this is the case, you will get a CT scan prior to your surgery. This CT scan will be uploaded into the system software and a 3D model of your knee or hip will be created. The model will be used to create a personalized surgical plan based on your anatomy and will assist the surgeon from performing your surgery. After surgery, you may have small incisions from the pin sites. This incision may have drainage for up to 10 days. What should your surgeon and your Tanner team know before your surgery? Do you see a specialist like a cardiologist or heart doctor, a pulmonologist or lung doctor, a neurologist or brain doctor, nephrologist or kidney doctor, a doctor for your diabetes, that will be called an endocrinologist, or any other specialist? We'll also need a complete list of your medications, including vitamins, over-the-counter medications, or medications that you only take on occasion. Blood thinning medications are especially important because you'll have to hold those prior to surgery. We'll also need to know that you have a plan for after surgery. Is there someone that will be helping you at home? The coach's role. Your coach is the person who will be assisting you at home after your surgery. This person can be family or friends or an outside resource. It is very important to have help, especially during the first weeks after your surgery, depending on your progress. The coach will provide motivation and encouragement, prepare the home for a safe return, be knowledgeable of the home exercise program, review new medications with the nurse prior to discharge, understand the discharge instructions, Encourage attendance at the follow-up doctor's appointment and therapy appointments, and recognize the signs and symptoms of complications. Please remember to arrange transportation for when you are discharged from the hospital and arrange for a caretaker to remain with you for at least 24 hours following your procedure. Again, that depends on your progress. Take this time to decide if you have any questions before we move to the next session. You can ask these questions to your preoperative nurse, the orthopedic and spine coordinator, or you can call your surgeon's office. What should you expect at your pre-admission and testing appointment? You may hear this referred to as PAT visit or your preoperative visit at Tanner. Prior to this visit, a nurse will have called you to go over your health history, allergies, and medications. For your safety and preparation for your surgery, you will be asked several times to verify your name, birthday, allergies, and the procedure you're having by different staff in different departments. During your in-person PAT visit, the nurse will review all of your medications and go over instructions for the evening before and the morning of surgery. You'll have a nasal swab to screen your nose for staph colonization of MRSA, and you'll have blood work done. You'll receive directions to properly use the Sage wipes, the antiseptic wipes, the night before your surgery to reduce the risk of your infection. You may see someone from the anesthesia department. You may have an EKG, and you may have an X-ray of your neck. We want you to be as healthy as possible before surgery. Here we call it optimized. There are certain health conditions or habits that can delay healing and increase the risk of complications. Those include a BMI greater than 30, uncontrolled diabetes, poor nutrition or malnutrition, nicotine use, or high blood pressure. Tanner Health System's Get Healthy, Live Well offers evidence-based programs in the community to help you on your journey to a healthier life. These programs are taught by certified lifestyle educators. You can find these resources at tanner.org/livingwellresources. What should you bring with you the morning of your surgery? Loose, comfortable clothing to wear the duration of your stay. Your surgeon should let you know how long you should expect to be here. But even if you plan on going home the same day, pack an overnight bag in case your surgeon would like for you to stay for observation. If you're having a knee replacement, please wear shorts, a dress, or loungewear. Try to avoid jeans as this will hinder our ability to see your incision. Wear flat supportive walking shoes that are non-slip with an enclosed heel. No Crocs, slippers, or slides. Bring any specialized home medications in their original container. Do not bring your medications in a pill organizer. You will not take home medications except under very special circumstances. Bring your brace, walker, or any other assistive devices that have been prescribed to you, or if you have received prior to your surgery. If you wear a CPAP or a BiPAP machine, bring that with you if you plan on staying. If you use contact lenses, please bring the solution and the containers. Do not wear contact lenses the day of your surgery. If you have an advance directive or living will, please bring it if you don't have one already on file at Tanner. Also, bring your Joint Academy binder. Someone will call you around lunchtime, the business day before your procedure, to give you your arrival time. Before your surgery, do not do any drugs, drink any alcohol, or use tobacco or nicotine 24 hours before. That includes beer, wine, vapes, and smokeless tobacco. Don't have anything to eat or drink after midnight except for what your PAT nurse has advised. Do not bathe the morning of your surgery unless advised by your PAT nurse. You will use the wipes again when you get here. Do not shave your surgical area for 2 days prior to surgery, including the morning of surgery. Your PAT nurse will go over this in detail with you at your appointment. Do not wear nail polish or fake nails. Do not wear makeup, including foundation, eyeliner, mascara, lashes, or lipstick. Do not wear body piercings. Do not apply lotions, oils, powders, or deodorant the evening before or the morning of your surgery. We want the sage wipes or the antiseptic wipes to be all that is on your skin. And please do not bring valuables with you. If you're having surgery in Carrollton, please enter through the outpatient and surgery entrance on Clinic Avenue. There, free valet parking is provided. Check in at the registration desk on your left. It is very important to make sure the wristband has your correct name and birthday. Sign in at the short stay desk on the right. Pre-op wait times vary. Your family will be allowed to wait with you during that time. If you're having surgery in Villa Rica, enter through the surgical services entrance on Old Stone Road. This is also the emergency room entrance. Go through the doorway on the left and take the elevator to the second floor. Once you're on the second floor, check in at the registration desk. Again, it is very important that you make sure the wristband has your correct name and birthday. Pre-op time waits vary, but your family can stay with you. When it's time to go back for pre-op, you'll be provided with a hospital gown and non-slip socks to change into. You'll be assisted with a second application of antiseptic solution or sage wipes and have a nasal antiseptic applied. A pre-op holding nurse will review your paperwork and medical history. It is very important to tell your nurse if you've had any changes in your health since your last visit with your surgeon. Tell your nurse if you have any open wounds, rashes, or sores. Your medications will be reviewed and will document the last time you took each one. You'll be asked about the last time you had anything to eat or drink. An IV will be started and appropriate medications may be given, including antibiotics for infection prevention. The surgical site will be marked by your surgeon. An anesthesiologist will speak to you about your anesthesia. If applicable, you may receive a block in your surgical extremity. This will assist with controlling pain after your surgery. Pre-op wait times may vary, but you will be updated frequently. When going back to the operating room, you will be transported to the operating room by your surgical team on a stretcher. Your family will be directed back to the surgical waiting area, and they will be updated periodically throughout the procedure. They should sign back in at the reception desk. This is also a great time for them to get something to eat, but have them leave their cell phone with the reception desk so they can be contacted if needed. Once you get into the operating room, your anesthesia will be administered by the anesthesia provider. Some blood loss is expected. If not contraindicated, you may receive a medicine to help decrease your need for a blood transfusion after surgery. Surgery time can vary from 2 to 3 hours. When you leave the operating room, you'll go to the post-anesthesia care unit. You may hear us call this the recovery room or the PACU. You'll have oxygen in your nose, a blood pressure cuff on your arm, a pulse oximeter on your finger, and a surgical bandage on your incision. Your comfort, pain, and nausea will be assessed, and medications will be administered as indicated. Your stay in PACU will be about 30 to 60 minutes. Take this time to think of questions related to the presentation. After surgery, you will either go to the short stay unit if your plan is to go home the same day, or you'll go to One West if you'll be staying with us for observation. In any area, your nurse will monitor your vital signs. Your surgical leg, hip, or knee will be elevated, and your incision area will be iced to help decrease swelling. Remember, do not place a pillow under your knee and create a bend if you had knee surgery. Your nurse will educate you and your coach about pain management and the plan of care. Physical therapy will begin to see you if you are moved to your destination by 6 p.m. Otherwise, you can expect that your nurse will walk you. Your progress and readiness for discharge will be assessed frequently. If you stay here for observation, we will get labs early the next morning to see how your blood cell count looks. You'll be assisted with your daily cares like bathing, standing at the sink to comb your hair or brush your teeth, and dressing. Physical therapy and occupational therapy, if ordered, will visit you first thing in the morning. You will have 2 sessions of physical therapy the first day after your surgery. We want you to plan to get out of the bed and sit up in a chair and wear your clothes instead of a hospital gown. Remember, you are not sick, just recovering. Your nurse will float your heels to prevent an injury on your heels and help you turn in bed if needed. This will prevent pressure injuries or bed sores. Your nurse will encourage you to turn, cough, and deep breathe and use your incentive spirometer to help prevent pneumonia or other lung complications. Also, sitting in a recliner will help with this as well. Your nurse will encourage you to walk or do ankle pumps to prevent blood clots. Your nurse will teach you about infection prevention, constipation, and other topics related specifically to you. Your nurse will administer all of your medications. Please do not take medications from home. If you go home after your surgery on the same day, physical therapy will see you once while in the short stay unit and assess whether you can safely return to your home. They will demonstrate using the walker, taking stairs, and after surgery exercises. You and your coach will get the after surgery care instructions, including medications, appointments, referrals for home health, equipment, complications, circulation hose, etc. Your coach will sign the discharge instructions. Because of sedation, you will not be able to. Once you get home, take the rest of the day to rest while managing your pain, doing your lung exercises and ankle pumps. Make sure that you are icing and elevating to help prevent swelling. Your coach will encourage you to turn, cough, and deep breathe and use your incentive spirometer to help prevent pneumonia or other lung complications that are a risk of surgery. Also, sitting in a recliner will help with this. Your coach will encourage you to walk or do ankle pumps to prevent blood clots. Your coach will keep the home safe by keeping a clear path for your walker. They will be available for support and help provide nutritious meals. Increase your vegetables and protein and iron. This will help aid in healing. Pain management. Everyone experiences pain differently. Your pain after surgery may be more or less tolerated than your neighbors or your peers. Pain is expected after surgery. It is not completely eliminated. The pain medication works best when taken consistently as your pain begins to increase and before it becomes severe. While you're in the hospital, your nurse will ask you about your pain frequently. We want to keep your pain at a manageable level. Please let your nurse know when you need something for pain. While you're in the hospital, your nurse will ask you to describe your pain. Does it ache? Is it shooting, burning, stabbing, or throbbing? Your nurse will ask you if the pain is constant or if it comes and goes. We can use IV or pills for pain management in the hospital, but we like to begin pills as soon as they're tolerated. Here at Tanner, we use a pain scale to help determine your level of pain. When you get home, follow the directions. Do not take more medication than prescribed. Do not drive while taking narcotic pain medication. Do not drink alcohol or take other sedatives or mix your pain medication with recreational drugs. Pain medications can cause nausea, so take them with food on your stomach to help. Preventing falls. After surgery, it is not uncommon to have a drop in your blood pressure, dizziness, fainting, or loss of balance. Never attempt to get up alone. In the hospital, while you're here, in addition to your walker, 2 clinical staff members will assist you to the chair, bathroom, or bedside commode. Please use your call light for any needs. We are here for you and strive to give you exceptional care. Call for help before you step. At home, have your walker close and assistance when getting up. There are many things that can be implemented in the home to prevent falls, like removing rugs, extension cords, and containing animals that may trip you up. Take your time when changing positions from laying to sitting to standing. More resources for fall prevention are at the end of this presentation. Preventing nausea. After surgery, you will first have ice chips or water. Then you can advance as tolerated to your regular diet or as directed by your surgeon. Pain medications can cause nausea. Taking them with food on your stomach helps. Your surgeon may prescribe something to take for nausea like Zofran or Phenergan at home. And if you're in the hospital, we can also administer these medications with an order. Preventing constipation. Constipation is a major side effect of pain medication. If you're in the hospital, we will give daily medications as ordered by your physician to help. Those are stool softeners and laxatives. At home, make sure you have stool softeners and laxatives available if needed and suggested by your surgeon. Walking will help wake your belly up after anesthesia. Increasing your fluids, fruits, and fibers will also aid in constipation prevention. Preventing infection after surgery. Hand washing. Everyone, staff, family, and visitors who come into and out of your room should sanitize their hands while you're in the hospital setting. At home, ask your visitors to do the same thing. If your hands are visibly soiled, use soap and water. Protect your environment. Restrict pets from the area that you're sleeping and contain them in another room when your dressing is being changed. Don't remove your dressing unless you've been instructed to do so. If you're wearing circulation hose, be sure to launder them appropriately. Wear clean clothes, use clean bath towels, and sleep on clean linens. A low-grade fever is expected the first few days after surgery. We treat temperatures that are greater than 100.4. If your temperature at home is greater than 100.4, treat your fever, notify your surgeon. Make sure you have a working thermometer at home prior to surgery. Your dressing. You may have a silicone dressing with silver. If ordered, home health may manage this dressing. This dressing can stay in place for 7 days if not soiled, greater than 75%. If this is the circumstance, please report to your surgeon or home health nurse. Make sure all the edges are sealed. Do not lift this dressing. Typically, staples are used under this dressing. Mesh with a liquid adhesive. This is a closure system. Do not remove this. Negative pressure incision management system. This is a closure system that helps pull the edges together of the incision and remove any excess fluids. This may be managed by home health if home health is ordered. It stays in place for 7 days and needs to be changed if it needs to be continued. With all of these dressings, please do not use lotions or oils around them because it may damage the adhesive. Preventing pneumonia. Do cough and deep breathing exercises. Inhale deeply, hold your breath for a few seconds, and then cough 1 to 2 times. You will go home with an incentive spirometer. That's the device that is shown in the illustration on this slide. Inhale on the mouthpiece slowly, keeping the side float between the arrows. Hold your breath for a few seconds, then allow the center float to completely return to 0. Complete this exercise 10 times every hour while you're awake. Turn. Don't stay in one position for greater than 2 hours. This also helps prevent pressure ulcers or bed sores. You can use pillows to help wedge or prop for comfort. Positioning. Try to stay upright in a recliner. In the hospital, we can adjust the head of your bed. This helps you breathe better. Blood clots can be prevented by taking blood thinners, early ambulation or early walking, and mechanical devices. If you routinely take a blood thinning medication before surgery, it is restarted after surgery. Your surgeon may prescribe Eliquis or may have you take aspirin for a determined amount of time. Make sure you follow the directions. Early walking. Our goal is to have you walking 2 to 4 hours after you're out of PACU. At home, walk 5 to 10 minutes every hour as your strength and balance improves. Increase the amount you walk. Mechanical devices. If you're admitted to the hospital for observation, we'll use SCDs or sequential compression devices that are used in the hospital. They are worn on your legs and inflate and deflate. At home, you may be instructed to wear TED hose or other compression sockets. Please make sure that these are removed for 1 hour every 12 hours. Discharge from the hospital. We will wait until your coach, family member, or other caretaker are present before going over discharge instructions. You will not be able to drive yourself home. Your nurse will review discharge instructions, give you and your coach education on any new prescriptions and how to recognize the signs and symptoms of complications. The prescriptions will be given to your coach, family, or your caretaker to be filled for you if this was not done prior to surgery. After discharge, if you have questions regarding your medications, please contact your physician. You will have instructions on how to care for your incision. You should not remove the dressing. We do want you to look at your dressing and skin surrounding your dressing every day. Let your surgeon know if there's any drainage, redness, rash, or the skin is hot to touch. You should already have an after-surgery appointment scheduled with your surgeon. If not, call as soon as you get home to make that appointment. Care coordination. It is our expectation that you return home after surgery versus going to a rehabilitation center. The care coordinator or case management will help discuss your discharge plans, assist with any insurance or coverage questions, plan for medical equipment if needed, and plan to communicate with referrals for home health care if ordered and not already in place. We plan for you to go home with family or coach, or go home with family and coach and home health. Home health nursing will see you 1 to 2 times per week, and home health therapy will typically see you 2 to 3 times per week. If you do not have home health nursing or therapy ordered, your surgeon may order outpatient physical therapy for you. If this is the case, please discuss with your surgeon that plan. After surgery, limit your activities for the first 24 hours. Do not make personal, business, or legal decisions 24 hours following anesthesia. Do not make personal, business, or legal decisions while taking narcotic pain medications. Do not drive, operate machinery, or use power tools while taking narcotic pain medications. And rest is needed. It is normal to feel weak and fatigued after your procedure. When to call the surgeon. Call the surgeon if you experience a fever greater than 100.4 that does not resolve with medications. If you have numbness, tingling, decreased sensation, decreased temperature, and/or color changes in the surgical extremity. If you have extreme pain that is not relieved with your pain medications. If your dressing becomes soaked with blood, or if you have bleeding that does not stop when pressure is applied. If you have excessive swelling, red streaks, or the skin is hot to the touch around the incision. If you have pain, swelling, redness, and skin that is hot to touch in the calf of either leg. If you have not had a bowel movement in 3 days, are having abdominal pain, or having excessive nausea or vomiting. Call 911 if you have chest pain, difficulty breathing, slurred speech, weakness on one side of your body, or confusion. Common questions. My hand is sore where the IV is. Is that normal? It can be. You can use a warm compress. If it persists or get worse after, or you get a fever, call your surgeon. My throat is scratchy and sore. Is this okay? Can also be expected and usually clears in a few days. Can I take anti-inflammatory medications like Advil, ibuprofen, or Aleve? Ask your surgeon first. Always ask before taking a medication in this class because it has blood thinning properties. And remember, you are already on a blood thinner after surgery. Do I or will I have staples? And when do those come out? Depending on your dressing or closure system chosen by your surgeon will determine if you have staples or not. You will know this surely when you are discharged. Staples are typically removed 2 weeks after surgery by home health or your surgeon's office. I've heard that I should take an antibiotic in the future for dental procedures. Is this true? How does this work? You will get information from your surgeon's office about this preference. Call your surgeon's office when you have dental cleanings or procedures scheduled. They will call in antibiotics as needed. Take this time to think about any questions you may have for your care team. Rehabilitation, or getting stronger before surgery. Prehab teaches you the skills and exercises that you will need after surgery. Patients that participate in prehab recover more quickly. There are programs that are offered in the community that are more formal, but those will have to be ordered by your physician. If you are not in a formal prehab program, we're going to show you some exercises to do before surgery that will get you stronger. Start those today. Preparing your home before surgery. Remove all throw rugs. Move all electrical cords out of the way. Move items within your reach. Widen pathways for a walker. Check the height of your bed. Is it easy to get in and out of? If it is difficult now, it will be more so after surgery. Check the height of your sitting chair. Is it low? Can you add pillows to increase height or firmness? Have a safe place for your pets to be contained. They can be a fall risk. Have meals planned that can easily be prepared. Install handrails on stairs if needed. Consider non-slip tread on stairs or in the bathtub or shower. Install grab bars near the toilet or in the bathtub or shower. How far is your bathroom from your bed? Consider a bedside commode. Have lighting like night lights with motion sensors or lamps in hallways, bedrooms, and bathrooms. What contributes to falls? Feeling weak, dizzy, tired, sick, or simply not strong enough to stand or walk. Medications, slippery or wet floors, obstructed pathways like clutter and rugs. You can prevent falls by increasing your strength and doing your prehab exercises. Call for help before you get up and have your walker nearby. Stay hydrated. Dehydration can cause dizziness. Have your vision checked if needed. Let your surgeon know if your medication is causing you to be in too much of a fog or causing you too much dizziness. Sit in chairs with armrests that do not have wheels. Wear firm, flat shoes that do not slip and have backs. Replace rubber tips on canes or walkers and use your walker properly. Rise slowly from sitting to standing and always think before you move. The following slides will discuss prehab exercises and how to do them. This first one is called a quad set. Tighten the muscle of your thigh on a straight leg. Hold for 5 seconds. Do this 10 times on each leg and do this 3 times per day. With all of these exercises, do them on each leg, not just the surgical leg. Straight leg raise. Lie on your back and bend one leg. If it helps your back to sit reclined to do your straight leg raises, that is also okay. Keep your other leg as straight as possible and tighten the thigh muscle as you slowly lift the leg off the bed. Lift as much as you can, but no more than 12 inches. Hold that position for 5 seconds, then lower slowly. Do this 10 times on each leg, and do this 3 times per day. Long arc quad. Straighten the leg while tightening the thigh muscle. Hold for 5 seconds, then slowly lower. Do this 10 times on each leg. Do this 3 times per day. Tricep dips in chair. Why would I need to strengthen my arms if I'm having a surgery on my lower extremity? You may not be used to pushing a walker around. And while using your walker, you'll be relying a lot on the strength of your arms. It's very important to do this exercise. Place both hands on a stable chair and push your body up out of the chair. To prevent a fall, do not use a chair with wheels and keep your buttocks over the seat of the chair. Do this 10 times per day. Do this 10 times and then repeat it 3 times per day. Bridges. Lying on your back, slowly raise your buttocks from the floor, keeping your stomach muscles tight. Hold that position for 5 seconds. Do this 10 times and do it 3 times per day. This will help you shift in bed after your surgery. Our team will work with you to improve your functional abilities and will teach you proper body mechanics and safe procedures for transferring in and out of the bed, walking with a walker, completing your home exercise program, climbing stairs, getting up and down out of a chair, using a gait belt. Please note that these are not provided, and if you prefer one, you will need to purchase one before your surgery. Preventing falls, proper positioning, pain management alternatives, and other equipment or education and device training is needed. Your recovery is a commitment for us. It is very important to work hard with therapy, whether you are at home or in the hospital. At home, you may not have home health physical therapy ordered. You and your coach will need to commit to completing the exercises that were given to you during your hospital stay. Occupational therapy. Occupational therapists work with patients to improve functional abilities to complete activities of daily living. They teach proper body mechanics and safe procedures related to activities of daily living. Not everyone is ordered occupational therapy. If you are, this is what you can expect. Dressing, bathing, going to the bathroom, grooming and hygiene, transferring, strengthening exercises and home exercise programs, assistive device training, fall prevention, and activities of daily living kit can be purchased prior to your surgery or from the gift shop here at Tanner Medical Center. This is some equipment you'll need after a knee replacement. The knee immobilizer. You will have specific instructions from your surgeon on how and when to wear this in your discharge instructions. Sometimes your thigh muscle, your quadricep, is weak after surgery. The knee immobilizer helps keep your legs straight and prevent a fall. The only time a pillow can be placed under your knee is when the immobilizer is on. A standard rolling walker is used to help support your surgical knee while walking after surgery. And the gait belt is placed around your waist to help support you while walking to prevent a fall. Again, these are not provided by the hospital, but used at the hospital. If you feel like you'll need one when you're at home, please purchase one prior to surgery. Equipment for after a hip replacement. If you're having a posterior hip replacement, and if this is ordered by your surgeon, you may have the abduction pillow. That's the pink triangular looking pillow that's illustrated in the slide. This keeps you from accidentally crossing your legs when you're sleeping. A standard rolling walker is used to help support your surgical leg while walking after surgery. Gait belt is placed around your waist to help support you while walking to prevent a fall. Posterior hip precautions. The posterior and posterior hip replacement simply indicates where your incision is made and the angle in which your surgery is completed. If you are having a posterior hip replacement, your surgeon may want you to follow posterior hip precautions. Do not cross your legs. Do not bend your hip past 90 degrees. That would be like putting your knee to your chest. And do not turn your toes in. Transferring in and out of the bed. Walk up to the surface with your walker. Turn on the leg that is opposite your surgical side until your buttocks is square against the bed. Place your hands behind your hips on the bed and scoot into or out of the bed. Use your arm strength. Getting into the car. Walk up to the car with your walker as closely as possible. Turn on the leg that is opposite your surgical side until your buttocks is parallel with the car. Reach back with your hands and scoot into the seat. Use the grab bars for stability. Rotate your legs into the car. Thank you for choosing Tanner Orthopedics. Take the quiz that is online at tanner.org. It can be found under Services, Orthopedic Care, then Resources, or you can scan the QR code. If you prefer a written quiz, please ask your Tanner nurse or the orthopedic and spine coordinator. As a reminder, please complete any health questionnaires that have been assigned to you through MyChart if you have not already. If you do not have MyChart, your preoperative questionnaires will be answered during your pre-op appointment. If you prefer to verbally complete these questionnaires, please let your Tanner health nurse know or the orthopedic coordinator. Again, the Tanner Resource for Orthopedic and Spine Services is the coordinator. That person can be reached at 770-812-5547. Thank you for choosing Tanner.